2 lectures. This first part of the lecture will be basic introduction to the classification of diseases, definition of diseases, and how the diseases they are transmitted and all that, basic things about disease. The next part will involve few details about immunity, and we will talk about few health organizations that are working at international level. Okay, so that's the plan. So let's start with this lecture, and I hope you can see the slide. The health and disease. So health is, as you know, according to the WHO definition, it is a state of physical, mental, and social well-being, and not just absence of a disease. Okay, so there is a difference between absence of disease and health. Health has physical, mental, and social components, along with absence of the disease. Now let's go through these in more details. What is physical well-being? So you do not have diseases, physical diseases like diabetes, high blood pressure, heart disease, or kidney problem. So your organs are functioning well. That is physical well-being. What is mental well-being? Now, WHO, that is World Health Organization, defines mental health as a state of well-being in which the individual realizes her or his own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. So that's the definition of mental health. So this has got different components. You know, when you get notes, your NITA teacher will give you notes, and you can go through these components again. So where it's a state of well-being in which the individual realizes their abilities. They can cope with stresses. They can work productively and fruitfully, and they are able to contribute to their own and their community's well-being. So that's the mental health. So next part is, what is social well-being? So social well-being refers to social equality. So people are treated equally in the society. There is no differentiation on the basis of caste, religion, color, or how much property they own, or what job they do, what political party they support, what ideology they follow. There's no differentiation. There's equality in the society. Equality doesn't mean everybody has got same amount of money, same house. Equality is equality of the treatment they receive in the society. The housing, income, the security in the society, how safe they feel while living in the society, and the economy, environment, sanitation facilities, these all represent social well-being. Okay, so health is physical well-being, mental well-being, and social well-being. And absence of disease and the health are different in the sense health involves the social well-being, your environment, your surrounding, your housing, safety, equality, your economy, job situation, income, all these are included in health. Okay, so let's move on to the next topic, which is disease. So whenever there is an absence of health and well-being, that person is supposed to have a disease. So what is disease? Disease is dis plus ease. Ease is comfortable. So when someone is not comfortable, they're not functioning normally, or their state of health is deviated from normal, then that is the state of disease. Okay, so deviation, malfunctioning organs, that's disease. How do we diagnose disease? So when someone has a disease, when they are ill, they tell us about the complaints like headache, fever, body ache, weakness, vomiting. These are complaints told by patient. They are called symptoms. When doctor examines patient and finds out what is wrong with the patient, like when they measure blood pressure or when they listen to the chest and find out exact problem in the patient, these all findings which doctors find out are called signs. So symptom is what patient tells, sign is what doctor finds out. And some people, some patients may need certain tests to diagnose the disease. Now, what are the causes of disease? The causes can be immediate causes that lead to disease, or there can be contributory causes. So immediate causes and contributory causes. We'll have a look into more details of these. Immediate causes can be external or internal factors. Now, if you look into different books, they will describe these causes in different ways. So you just have to have your own way of describing this. Stick to one book or one set of notes and just remember that, because different books will have different system of describing all these things. So causes of the disease, immediate causes and contributory causes. Immediate are the primary causes for the disease, and they can be identified after first checkup. So they can be internal or external causes. So internal causes can be some problem inside the body, like genetic problem, some problem with the immunity. Yeah, these are internal causes, some organ dysfunction. External causes will be environment or microorganisms such as bacteria, viruses. These are external causes. Immediate causes can be infectious or non-infectious. Okay, so they can be because of the microorganisms or not because of microorganisms. Infectious causes, they are bacterial, viruses, worms, fungi. So these are different microorganisms leading to infectious diseases, infectious cause of the diseases. Non-infectious causes can be genetic problems or lifestyle related problem like excessive weight gain, smoking, alcohol. So these are not infectious and they can lead to cancers or high blood pressure, heart attack, diabetes. So that's about immediate causes of the disease which cause disease directly. And there are causes which contribute to the disease. So they support the immediate causes to disease process to move forward. So contributory causes of the disease are unhealthy living conditions, someone living close to dirty water, close to large gutters, drainage, which are not cleaned regularly, close to factory where there is a lot of pollution of air, pollution of water in the surrounding area, improper public facilities, no sanitation, no proper drinking water, no good toilets. So there is open air defecation. The toilet water is flowing in the area and that is mixing up with the tap water and that is giving diseases. So these are contributing factors. So actual immediate cause is bacteria, virus, these kind of factors. But what contributes to that is unhealthy living condition, improper public facility, or poverty. So in poverty, people have no access to good food, nutritious food, no access to healthcare facilities. They eat poorly nutritious food, that has no nutritious value. So these all things are contributory causes of the disease. So immediate causes, contributory causes. Immediate can be infectious, non-infectious. Contributory can be unhealthy conditions, improper facility, public facilities, and power. Now, how are the diseases classified? So these are the parameters based on which diseases can be classified. If you read different books, you will get different ways of classification. The first way is extent of the disease spread, disease occurrence. And based on that, diseases can be classified as sporadic, endemic, epidemic, or pandemic. Now, you must know this from COVID now. COVID is a pandemic because it has spread in many countries in the world. So that is the definition of pandemic. Now, what is endemic? So endemic are the diseases which are there confined to a limited area, and then people get affected from that. Some people in that area get affected. So the disease remains in that area, in a confined area, limited area, and people get infected every now and then. So example of this disease is goiter. So if you look at the sub-Himalayan areas, the people that live at the bottom of the Himalayan regions, they get goiter. So goiter is a swelling in the front of the neck of thyroid gland. And why does that happen? Because those regions do not have iodine. So iodine is lacking. That's why people get uh, development of a swelling of their thyroid gland. It is called goiter. Other examples of endemic diseases are malaria. Malaria is there in many parts of the world, especially African, South Asian countries, and South American countries. In India also, lots of states have got malaria present uh, as an endemic disease. So, for example, West Bengal and Madhya Pradesh, even in some districts of Maharashtra, there is a lot of malaria. So these areas have got regular occurrence of cases. Sometimes there is increase in cases, that is called outbreaks. So that is endemic. Sporadic is when the disease occurs rarely, infrequently. Now, examples of that sporadic are diphtheria. It very rarely happens here and there. It's not commonly seen, but we will hear in news, oh, there are diphtheria cases. Even in medical practice, we come to know, oh, this patient is diphtheria positive. So every now and then, infrequently, irregularly, they will happen. That is sporadic. And we have epidemic. So epidemic, again, the disease, uh, there are cases, uh, cases rise in certain areas suddenly, and that is called epidemic. So number of cases will go up in that population, and that is called epidemic. For example, we had a plague epidemic in 1994. Suddenly the cases increased and then they went away. That is epidemic. So that is sporadic, endemic, pandemic, epidemic. I'll try to explain you again through this figure. So endemic is disease is there, it's constantly there in confined areas, small areas, and there is a low spread. Yeah. And some people get affected with it. So that's endemic. Epidemic, when sudden increase in cases in a limited area, like we had plague in 1994. That is endemic. And pandemic is when there is a sudden increase in cases in several countries, continents, or whole world. That happened in COVID. It also happened because of HIV. It went to every continent in almost every country, and large number of cases were found. Now, The second way I said was based on occurrence. The first classification was based on extent. How big is the extent of the disease? Now, second is occurrence. Based on this, we have congenital disease or acquired. So, congenital diseases, as you might have heard, color blindness or hemophilia. These are examples of congenital diseases. They are there because there is some problem before you are born. It's a birth defect. Now, acquired diseases, you acquire them, you get them when you after you are born. So they can be communicable or non-communicable. Now, communicable diseases, they can be contagious or non-contagious. So contagious means spread through direct contact. Non-contagious means they do not spread through contagion, contact. If you touch the people who are suffering from this disease, you do not get that disease. So contagious like smallpox, ringworm. Ringworm is a fungal infection people get in the neck or in the groins lower down. They are contagious. You can get them through touch, direct contact. Whereas malaria, if you touch people with malaria, you don't get malaria. If you touch someone who has got cancer or tuberculosis, you don't get those diseases. So they are non-contagious. Okay. Most cancers are non-communicable, but some cancers can be due to infectious agents, but they are still non-communicable. Now, non-communicable diseases again can be classified into 4 groups. Again, different books will give you different classification system: degenerative, deficiency, allergies, and cancers. Some books will give social causes as well. So let's go into that as well. So these are the groups of non-communicable diseases: degenerative diseases, deficiency, allergies, and social diseases. Degenerative, where there is a degeneration, aging, wear and tear because of the normal age or because of the unhealthy lifestyle. So the tissue of the body undergo wear and tear. It's either normal aging or because of the unhealthy lifestyle, the tissues will undergo wear and tear. Examples are osteoporosis of the joints or arteriosclerosis of the blood vessels. So these are degenerative diseases. जसे लोक म्हातारे होतात, वय वाढतं, तशी सांधेदुखी सुरू होते. आणि ही सांधेदुखी का होते, तर जो जॉईंट असतो 2 हाडांच्या मधला, त्याचं वेअर अँड टेअर होत, झीज होते. ती झीज झाल्यामुळे ऑस्टिओ अर्थरायटिस असा आजार होतो. ओके, ऑस्टिओ अर्थरायटिस, दॅट इज बिकॉज ऑफ द degeneration of the joint surfaces. Similarly, blood vessels मध्ये arteriosclerosis होतो. These are degenerative diseases. Degenerative diseases of the brain, they also give different problems. Now, second class of non-communicable diseases is deficiency diseases. Lack of nutrients, lack of vitamin A will cause night blindness. Lack of vitamin C will cause scurvy. Lack of vitamin D will cause rickets. So deficiency of certain nutrients will lead to deficiency diseases. Next group of non-communicable diseases is allergies. So you can have hypersensitivity or allergy. They are the same things. Hypersensitivity is allergy. Someone might be hypersensitive to atmospheric pollutant. Someone might be hypersensitive to some kind of grass. Now, people in our area are hypersensitive, allergic to Congress grass. There is a grass called as Congress gower. So people are allergic to that. Some people are allergic to pollen grains which come from flowers. So they give, these conditions can cause asthma or hay fever. Hay fever is when you get runny nose when you come in contact with these allergic substances. So allergies causing asthma, hay fever. Next group of non-communicable diseases is social disease. That is alcohol, smoking, or other drug addictions. So that was about classification of non-communicable diseases. Now let's look into communicable diseases. These are the diseases which can be communicated, transmitted from one person to other person. Now Louis Pasteur, remember this is pronounced as Louis Pasteur, yeah, very important scientist. Communicable diseases, Louis Pasteur found out that microorganisms which exist in our environment were responsible for the various diseases. Okay, so we have to go into details of these microorganisms if we want to study, if we want to look at the diseases. But we don't have to go through all of them right now. Just understand that communicable diseases are because of the microorganisms, or they can be because of the other organisms which are not microscopic, such as helminthic diseases. So worms. Worms are not microscopic, you can see them, yeah. But others are bacterial, viral, fungal, protozoal. Those organisms are microorganisms. Now Robert Koch, this person, he was a microbiologist. He found out rod-shaped bacteria were responsible for the disease called anthrax and tuberculosis. So TB is called as Koch's disease. Remember this. Tuberculosis is called Koch's disease because the bacterial invention, what bacteria caused it, was done by, that study was done by Robert Koch. Now here is a list of infections, infectious agents and the diseases. Bacterial diseases, they can cause dysentery, plague, diphtheria, cholera, typhoid, pneumonia. Viruses can cause common cold. Runny nose is usually because of the viruses. There's no treatment for that. Mumps. Mumps is when you have swelling of your cheek just in front of the ear. आपल्याला गालफुगी म्हणतात. Mumps. Measles, कांजण्या. Viral hepatitis, that is कावीळ. Dengue fever, chikungunya, chickenpox, and chickenpox is kanjanya. Measles is a different illness. Poliomyelitis, polio, these are all virus infections. Okay, I always get confused with measles and chickenpox. What are they called in Marathi? So fungal diseases are candidiasis and athlete's foot. Athlete's foot म्हणजे चिकल्या. Candidiasis म्हणजे गजकर्ण. गजकर्ण होतं लोकांना. आपल्याकडे उन्हाळ्यात लोकांना खूप होत आहे. Fungal disease. Protozoal diseases because of the protozoa. Malaria. Malaria is caused by Plasmodium protozoa. That is transmitted by mosquito bite. Okay. Protozoal disease, other examples are amoeba, African sleeping sickness, Kala Azar. And helminthic diseases are ascariasis and filariasis. These are worms. So now mode of transmission of communicable diseases. How communicable diseases get transmitted. And we know there is a direct transmission and there is an indirect transmission. Communicable diseases can be contagious or non-contagious. Contagious, they spread through direct contact, close contact, and indirect is they need something else apart from direct contact. So direct communicable diseases, direct transmission is through direct contact or droplets. When we speak or we cough, the droplets are spread in front of us and they can transmit the virus or bacteria. That happens in COVID, direct contact, droplet spread, or through placenta. Now, what is placenta? Placenta is a connection between mother and the baby in the womb, inside the uterus, who is not yet born, that is placenta. So diseases can be transmitted from placenta, from mother to baby, from placenta, through placenta. Or body fluids. So body fluids is our saliva, blood, semen, or other body secretions. So in communicable diseases which are transmitted through direct route, when one person gets such disease, it can spread to other if that other person comes in close contact. So if you have a family member who has a communicable disease which is transmitted directly through contact, through droplet, then that person can spread it to the whole family. That's why we have to isolate the person who has this disease. That isolation is also called as quarantine. And we have seen this during COVID. Whoever got COVID, they were isolated. They need to isolate in one room, or if you don't have separate room at home, then they need to go to the isolation center, quarantine center. So quarantine is isolation to prevent spread of the communicable disease. Okay. Now examples of this transmission are direct contact with infected person. The examples are chickenpox and smallpox. Droplet spread, so either through sneezing, coughing, spitting. These examples for these are flu, that is common cold, COVID-19. Because this book is old, this doesn't mention example of COVID-19. Diphtheria, influenza, and tuberculosis also spreads through through droplets. Now, from pregnant mother to baby, German measles can spread, HIV can spread, and body fluids like blood, semen, AIDS, and hepatitis B, hepatitis C, they can spread through blood and semen. So this is the communicable disease transmission by direct route. Now we'll see communicable disease transmission by indirect route. So indirect means not through direct contact or through droplet or placenta or body fluid. It needs some medium or some vector. Vector means mosquito, housefly, this kind of vector, or animals like dog bite. So you need an indirect transmission through vector, water, or our hands and fingers touching some surface, and then we getting infection. Clothes, utensils we used on day-to-day basis, and animal vectors. Look at the examples. Now, vector-borne communicable diseases are malaria, where female mosquito of Anopheles transmits plasmodium from one person to other person. Second example is cholera, dysentery, typhoid. These are transmitted by house flies. Okay, घरमाशा, उघड्यावरचं फूड खाल्लं, open food. When we eat open food from outside or from inside the house, if the house flies have sat and enjoyed that food, then they could have got these bacteria, viruses onto that food, and if we consume that food, then we get that infection. Now air is a medium, and epidemic typhus can be transmitted through air. You don't need to know details of these diseases, just remember them now. You will learn them in your next year or two. Unclean hands and fingers, ascariasis, worms, they can be transmitted through unclean hands and fingers. Articles like garments, utensils, so diphtheria, hepatitis A, eye infection, or skin infection, they can be transmitted via garments and utensils. And animal bite like dog bite to human can cause rabies. So these are the indirectly transmitted communicable diseases through vector, water, hand, finger, or articles or animal vector. Okay, so that's about communicable diseases. Next is we will look at this slide, which briefly tells about how the vectors transmit diseases and what can we do to control the transmission of these diseases. So housefly is a vector, rat, mosquito, and cockroaches. So housefly can transmit cholera, typhoid, amoebiasis. Rats can transmit plague and typhus fever. Mosquitoes can transmit malaria, filaria, and yellow fever. So see these three mosquitoes there: Anopheles, malaria; Culex, filaria; Aedes, yellow fever. Okay, so these are the diseases transmitted by different mosquitoes. Cockroaches can transmit cholera and other conditions leading to gastroenteritis. Right. So transmission by houseflies is explained here briefly. Houseflies carry pathogens from the infected person's stool or vomit, and they carry these pathogens to the food or the drink which is consumed by us. That's why open food sold in unhygienic conditions is not healthy. So they can infect this, such food can be infected via houseflies sitting on that food, and it can lead to diseases like cholera, typhoid, or amoebiasis. That's why we have to maintain proper cleanliness, sanitation. Food must be covered all the time. Don't eat open food inside the house or outside food. Where the stored food should be covered. We can use insecticides in different areas to get rid of the insects, houseflies, and safe disposal of the waste material, garbage from house, shop, or different areas. They will lead to decreased chances of spread through houseflies, decreased number of houseflies in our area. Now, rats can spread different parasites and microorganisms, and they can cause different diseases. So, rats alive or dead can transmit these pathogens, and dead rats can have certain pathogens which can go to alive living rats through rat flea. So transmission occurs from a diseased rat to non-diseased, that healthy rat, and the healthy rats then they can travel in different areas, and that can bring disease to human being. So that is why we have to have a rat control mechanisms. So rat proof bins in the storage area, we have to have proper storage of food grain or other material so the rats don't enter there. The housing condition needs to be better. Okay. And then there are certain chemicals, poisons, which can be used to kill the rats if there are too many rats in the area, like zinc phosphate. Mosquitoes, they bite human skin and then they suck the blood, and at the same time they introduce the pathogenic organism into the human blood. Then that organism undergoes a life cycle into the human blood, human body. And when next time mosquito comes and bites this human, that organism is sucked along with the blood, and then that goes to different human beings. That's how mosquito-borne diseases spread from one person to other person. So we have to have a good mosquito control measures. So we know what are the mosquito control measures. These are using insecticides to kill mosquitoes, prevention of the breeding sites of mosquitoes by eliminating the stagnant water, spraying kerosene or other oil over the surface of the water to prevent the mosquito breeding sites, and introduction of certain fish in the stagnant water like guppy fish. So these are the ways of mosquito control. Similarly, we can control cockroaches by spraying insecticides like DDT and maintenance of sewage systems. So these are the vectors, diseases which can be transmitted through them, and the ways we can control these vectors. Now, what we are going to see next is list of diseases, how they are transmitted, and what are the details of their control and prevention. So these are all communicable diseases, and you must know basic details, not too many details of these diseases at this stage. First is cholera. It is caused by a bacteria called Vibrio cholerae. And what happens in cholera? The main symptom is diarrhea and vomiting. Okay. And because of that, the patient gets dehydrated. They lose water. So if one loses water, you will get sunken eyes. The eyes go deep. You get muscle cramps because you lose electrolytes. If you lose electrolyte, your muscles will ache. You get muscle cramps. Now, how are they transmitted? By contaminated food and water because of the flies. What is the treatment? Treatment is oral rehydration solution. These ORS packets, that is the treatment of cholera. How to prevent it? You have to use hygienic water, hygienic food, home cooked food. If you eat outside, make sure it is a clean and hygienic place. Cover the food properly. Disposal of waste material properly so house flies don't gather around our house or living area. And there are cholera immunizations as well, which are not very effective, but they are available. In certain high-risk patients, you can use cholera immunization. Second disease described is tuberculosis. And the causative organism is again bacteria, Mycobacterium tuberculei. That is a cause of TB. Symptoms are cough, sputum, fever, sweating in the evening or at night, chest pain, blood in sputum, weight loss, and shortness of breath, that is breathlessness. So these are the symptoms of tuberculosis. How it is diagnosed? Symptoms, examination. So doctor finds out signs and we do tests. The important tests are sputum microscopy examination and we do chest x-ray. So we find out TB cavities on x-ray and sputum microscopy shows Mycobacterium tuberculei, this tuberculous bacilli under microscope. They are called acid-fast bacilli, AFB. So they are stained by AFB stain, acid-fast bacilli. You will know more details in your next year or two. So the transmission of TB is obviously when someone coughs or sneezes or spits, they are transmitted through those droplets from one person to the other person. Treatment is anti-tubercular therapy, ATT, or anti-Koch therapy. Remember, Robert Koch was the person who studied this bacteria, rod-shaped bacteria. That's why tuberculosis is also called as Koch's disease. So anti-tubercular therapy or anti-Koch therapy, AKT, ATT. Now, how to prevent? So we need to improve hygiene, improve immunity, improve nutrition, isolate people who have got TB, treat them properly. There is a BCG immunization. You remember having a scar there. You have an injection as a child and you get scar. That is a BCG scar. It doesn't always protect, but it gives some level of protection. Next disease is typhoid. And the causative bacteria is Salmonella typhi. It's a bacteria. It gives you fever, headache, lack of appetite, sometimes diarrhea, and sometimes vomiting. So that is typhoid. And it is transmitted in the same way as cholera through contaminated food, contaminated water, or unwashed raw vegetables. And this is transmitted by flies, house flies, or contaminated hands and fingers. The treatment is isolate the patient, because you can get this disease from their vomiting, from their stools, and if the hands are not cleaned properly, then this can be transmitted in other family members as well. And disposal of the excretory material. If someone vomits, if they go for a toilet, then proper cleaning is required, proper hygiene is required. Treatment for the typhoid is antibiotics, hydration. These are the treatments for typhoid. Now, these were the bacterial diseases we've seen: cholera, TB, typhoid. Let's have a look at some viral diseases. So, HIV, human immunodeficiency virus, that causes AIDS, that is acquired immunodeficiency syndrome. So, HIV is a virus, AIDS is the disease caused by HIV. Okay, HIV virus है, AIDS आजार है. HIV आजार नहीं, HIV virus है. Not everyone who gets infected with HIV gets AIDS. प्रत्येक HIV झालेल्या व्यक्तीला एड्स होतो असं नाही. एड्स हा अनेक वर्षानंतर होतो. So the people who get HIV infection, the HIV virus attacks on immune system, immunity becomes weak, and then that person, when develops AIDS, can easily get other infections like flu, diarrhea, TB, cancers. They can easily affect HIV infected person, and that is a problem. How is HIV transmitted? The main route is sexual relationship, sexual intercourse. So it is transmitted when people have unprotected sex without using condom, and also oral sex, when people do oral sex or unprotected sex. It can also be transmitted via infected needles if the doctor or nurse is actually uh, uh, get accidentally stuck with needle. So accidental needle injury from infected patient of HIV, then you can get this infection. Also, infected blood products can give rise to HIV infection. Baby can get it from mother through placenta. So how to control? So we have to make sure that when we are working with patients, we avoid needle stick injury, we check blood products properly, we screen them for HIV, and only accept the blood products from HIV negative people. That is about preventing through blood products or needle stick injury. Unprotected sex should be avoided. Sexual relationship with unknown people should be avoided, or sexual relationship with person who is high risk, who has multiple sexual partners, should be avoided. Otherwise, you are at risk of getting HIV infection. What is the treatment? There is an antiretroviral therapy, okay, for AIDS, for treatment of HIV. Antiviral therapy. It is called antiretroviral therapy. And nowadays, people infected with HIV, if they take proper treatment, they can survive long. So it is become controlled disease now. It is not as dangerous as it is used to be 20 years ago. So that is about HIV. Hepatitis A, hepatitis B. Hepatitis A is jaundice. It gives you jaundice, and it is again transmitted through contaminated food and water. Unclean hands, houseflies, they can transmit it. Treatment is hydration, and there is no specific treatment for hepatitis A. It resolves on its own. It's a self-limiting. Though there are vaccines available, but they are usually not needed, not very effective. There are also some specialist treatments like interferons, but they are not usually needed in normal people who have normal immunity. But in jaundice, people need to eat high calorie diet and limit their proteins and fats in the diet. Now, hepatitis B causes severe long-term infection. Hepatitis A is a short-term self-limiting infection. So hepatitis B can be very chronic infection. Earlier, there were no good treatments for hepatitis B and people died prematurely, but now we have very good antiviral agents to keep these patients alive for long period. How is hepatitis B transmitted? It is exactly same as HIV. Through it is sexual relationship, body fluids such as blood, semen, needle stick injury, and that is how it is transmitted. So avoid these injuries, avoid infected blood products, and avoid unprotected sex. That is hepatitis B. Chickenpox, again, chickenpox is caused by virus. The virus is varicella zoster virus, and it gives a skin lesions. It gives a skin crusts. They are formed all over the body. It also gives headache, fever. That is chickenpox. It can be transmitted by direct contact or indirect contact, such as when patient has touched certain utensils or surfaces, and if some normal person goes and touches those utensils and surfaces, it can be transmitted. So isolation is important in chickenpox. Avoid contact with the utensils and clothes of the patient. Treatment is, again, we can use some antiviral agents, but usually it is self-resolving condition and it gives long-term immunity. Once you get chickenpox infection, usually most of us have lifelong immunity against further infections. So that was about viral infections. We looked at HIV, hepatitis A, hepatitis B, and varicella zoster virus causing chickenpox. Let's have a look at few protozoan infections. And most important for us are malaria, amoebic dysentery. Sleeping sickness is not seen in our areas. It is more in African countries. It's also called as African trypanosomiasis. So malaria is caused by Plasmodium, and there are around 4 types of Plasmodium: vivax, oval, falciparum, and that gives rise to fever with chills, थंडी वाजून येते, डोकं दुखतं, मळमळ होते, आणि लिव्हर सुस्त. So enlargement of liver, headache, fever with chills. It is caused by Anopheles mosquito, which carries protozoa. Treatment: chloroquine is one of the treatments, but now there are various advanced treatments available. Artemether, artesunate, these are other treatments. Sometimes you need doxycycline or antibiotics if malaria gets complicated with bacterial infection. Patient might need to be admitted. So there are various other treatments available, but chloroquine is a basic one. How do we prevent? So prevent mosquito bite through insecticide spray, anti-mosquito coils, anti-mosquito insecticides like DDT spray and all that. Avoid stagnant water, use kerosene or oil for on the surface of the stagnant water. So that's malaria. Amoebic dysentery is caused by Entamoeba histolytica, and it gives rise to diarrhea, blood or mucus in the stool, and abdominal pain. It can cause dehydration, and it is usually caused by the same process as hepatitis A or cholera, flies carrying the protozoa through on the contaminated food or water. Treatment is by anti-amoebic treatment, that is metronidazole. How to prevent? Maintain hygiene, clean hand, clean food, clean water supply, cover your foods, avoid house flies, disposal of waste products properly so you don't attract house flies. Now, next one is sleeping sickness or African trypanosomiasis. It is caused by trypanosoma, and it usually gives rise to headache, anxiety, fatigue, insomnia, and lymph node swelling. It's not very common in our areas. Bite by this tsetse fly. See the spelling TSE fly. This fly carries protozoa, and that is transmitted from one host to the other host, and that's how you get infection. You can also get this through blood transfusion, and usually the treatment is by pentamidine or suramine. uh, I have never treated patient with sleeping sickness in India, so we don't need to worry about this. Prevention is avoid growth of this tsetse flies, avoid insect bite using mosquito net, or insecticide sprays. So that's about protozoal diseases. Now, few things about helminths, that is worms, helminthic diseases. Ascariasis, that is roundworm. It gives loss of appetite, vomiting, diarrhea, abdominal discomfort, and it is transmitted through unwashed raw vegetables. And due to lack of personal hygiene. So if someone is not cleaning the food properly, then you can get roundworm through uncooked, uh, dirty vegetables. Treatment is by albendazole, mebendazole. These are the anti-worm treatments. जंताच्या ज्या गोळ्या दिल्या जातात तुम्हाला शाळेत किंवा डॉक्टरकडून, त्याच्यामध्ये अल्बेंडाझोल, मेबेंडाझोल असतं. त्याच्या हे होऊ नये म्हणून काय करायचं, तर यू हॅव टू यूज प्रॉपर हायजीन, maintain proper sewage system, clean your vegetables. The next helminthic infection is teniasis, caused by Tinea solium, that is tapeworm. It gives the similar kind of symptoms: abdominal pain, indigestion, vomiting, diarrhea. Also causes anemia and weight loss. That is because of tapeworm, teniasis. It is transmitted through contaminated food and water, and it is mainly found in pork, which is called as measly pork. So pork म्हणजे डुक्करचं जे मटण आहे, pork, त्याच्यामध्ये tapeworm mainly असतो. But it can be found in other food sources as well and through water as well. So treatment is usually by albendazole and praziquantel. So we use this if we find out tapeworm on stool examination. If we do stool microscopic examination and if there is a tapeworm, then we use praziquantel and albendazole. So properly cooked food, maintain sanitation, maintain hygiene. That's the prevention. And filariasis, hattipai rog, filaria. So it is also called as elephantiasis, and it is called as Wucheria bancrofti. So that is the pathogen which causes filariasis, but it is transmitted by Culex mosquito. So mosquito bite results in transmission of Wucheria bancrofti that can cause filariasis. So what is filariasis? It obstructs the flow of lymph in the body, and that is why if the lymph is the watery material outside blood vessels, and that is carried through lymphatic vessels. So blood vessels carry blood, lymphatic vessels carry lymph, and if the filaria pathogen blocks these lymph vessels, then the water accumulates in lower limbs, in the legs, and that can cause leg swelling. They look like elephant leg. That is why it is called elephantiasis. The treatment of this is by diethyl carbamazine. That is DEC, diethyl carbamazine. Easy to remember, DEC. So how do you prevent? So prevent mosquitoes, eradication of the mosquitoes and mosquito repellents, mosquito nets. That's the treatment. Now, last part of today's lecture, incubation period. It is the period between exposure to the pathogen to appearance of the symptoms. So when you come in contact with COVID patient, from that day to when you get in symptoms of COVID, so this period is called incubation period. This period is required for the pathogen to replicate inside our body and then give symptoms. In case of COVID, this incubation period is from 2 to 14 days, but normally from exposure, from contact to symptom, usually symptoms appear within 5 to 6 days. Now, this period, incubation period, is different for different pathogens. So this diagram gives you different incubation periods. You don't need to remember all these. Just remember the simple ones. Influenza, common cold, usually occurs 2 to 3 days after the exposure. So if you have come in contact with someone who has a cold, you can get it in next 2 to 3 days. Now, important here is dengue. If mosquito bites you, then you can get dengue symptoms after 5 to 8 days. Yeah. Similarly, if you have drank dirty water or eaten a food which is infested by house flies, then you can get hepatitis A after 2 to 5 weeks, 15 to 40 days. HIV, AIDS, say 1 to 10 years. Once you have contacted infected person, unprotected sex, or infected blood, you can get AIDS after 1 to 10 years. Okay, so incubation period is very different, is different for different pathogens, different diseases. It also depends on your own immunity, uh, and various other factors.